This is the treatment plan for a lower mandibular two implants on the molars, tooth number 30 and tooth number 31, rendering the DICOM data 3D. Notice right here as I rotate the image that was rendered right here. Notice that the front chin was cut off when the scan was done. And then here we can play technically with the ISO value to render the image. But more importantly, notice that the front tooth number 25 has a big, huge granuloma, a big abscess that kind of destroyed the frontal portion of the bone right there. And the plan is to go ahead and place two implants and on number 30 and number 31. And of course, noting here, this is the mental nerve right here. This is the sagittal slice, and notice again from the sagittal slice right here, if we scroll the sagittal slice back and forth, we will notice that as we come to the area in the back, in the side that we are interested in, notice we have plenty of bone right there. Another way to look at it as we're scrolling back and forth is the actual coronal slice, and if we put the coronal slice backwards right here, we can look at the right left area right here, and we're scrolling it back and forth. We'll go real slowly forward from tooth number 32. Notice that on the lower left side right here, notice this is the area that we have in question of placing the implant there, and it looks like we have plenty of bone. The nerve is going to be all the way down there. This portion of the treatment plan shows what we do to the polyvinyl impression that was taken. If you do not have an intraoral scanner that can take an STL data directly in the patient's mouth, you can take PVS impressions and we can scan it through the cone beam scan, and we can here in the portion of the software render it 3D with this software. Once we do that, same thing here, this is a very accurate way of rendering this 3D, because here we can look at it as a sagittal slice, axial slice, and a coronal slice. And if we render this 3D completely, notice that we could really see what's going on with that impression, whether the impression is good or bad or whatever, you know. So notice again here as I scroll the axial or the coronal slice back and forth here, we can actually view what's going on with the impression that we have here. More importantly now, once this is digitized, you want to make sure, look, this is a tooth-borne case, and you want to make sure that the surgical guide will sit on tooth number 32 right here, which is going to be an actual stop. So you always want to make sure that you take a good polyvinyl impression of the posterior tooth. Should have probably put some rope wax around the distal portion of this impression, so you can capture that molar a little bit more, tooth number 32. However, we went ahead and proceeded and we did that for you. And if we go ahead and trace the border of this, the software will take it, generate a positive from it, put a base on it, and now we could see, notice again, this is the tooth number 32, and that's exactly the positive from the impression. That's not a very good impression of tooth number 32 there, which is going to be a distal stop for our surgical guide. So pay attention to that a little bit closer. So this, of course, is an STL format that can be printed. So this model can be printed. You don't have to pour it. And then we do the same thing with the bite. We took the bite that you took with the polyvinyl impression. We digitized it as well. And now, as a result, now this is in an STL format that we have as well. So to register the bite, this is the PVS impression that was digitized right here. And this is the positive from the impression that was taken right there. What we normally do is we take several points from the right and the left, and we kind of match it to the bite registration area that is in question right here. And notice that as we do it, we go ahead and we superimpose. Notice here the standard deviation that this software will give us to show the accuracy of the superimposition of that. 164, 264, and 0.0000144. So this shows you that this is not just using a radiographic guide with 4 markers on it and superimposing 4 markers. This is a lot more accurate than superimposing just 4 markers. Software match it, and notice here as we match it, this is the superimposition of the impression to the PVS impression, to the PVS bite that we have. Good. Once we registered the bite, we went ahead and labeled the teeth, and we labeled the missing teeth here in red so we can allow the software to give us the center of gravity or the load vector on each one of these teeth relevant to the opposing arch. And then we proceed actually to trace the nerve. So in this portion of the software, we went ahead and traced the right nerve where we have in question right there. And the way we did it was we kind of shifted the panoramic view back and forth and selected the points and traced the nerve right here back and forth where we can actually mark where the nerve is. And then once we're done, it gives us a good rope position of where the nerve is going to be and traces it automatically and show it to us in the volume view right here. Of course, in this portion of the software, we went ahead and segmented tooth number 18, 19, 29, and 32. And rather than using a standard library of teeth to position the teeth on tooth number 30 and 31 where there's missing, we could use nature and duplicate nature, and in this case we could use number 19, mirror image it, place it on tooth number 30, we could use number 18, mirror image it and place it on number 18, and then we could adjust the occlusion a little bit better. But notice that tooth number 32 had drifted a little bit more mesial, so it's going to be a bit of a challenge to fit both molars here the way the sizes are. But we should be able to put 2 molars, but maybe we will reduce the volume of the teeth mesial distally by about 20%. So here we reverse engineered the teeth, and initially I went ahead and selected tooth number 19 and I placed it on the opposite side, but again mesial distally the distance was not too good. So when I went ahead and did is taken number 18 and position 2 18s in there, and they barely fit. As you can see, we're going to reduce the volume in there. So if I were to click on the tooth here, notice this would give me the load vector of the tooth, and this actually will determine the implant position and the angle where this implant is going to go on tooth number 30. Same thing with tooth number 31. This will, if by clicking on it, it'll give me the load vector again. It shows you exactly where the load's going to be from the opposing dentition on this area and where the center of gravity of the tooth is that will be loading the bone in that site. This is the implant planning portion of the software, and what's unique about this software is we will not allow to freehand the position of the implant in this section. The implant will be determined by the safety zone and by the load vector. So by double clicking on the actual tooth number 30, for example, in this case I'll double click on it. Notice by double clicking on it, the system will give me a certain amount of a safety zone and the load vector around, and then from that point on the software will determine what size of the implant will be placed in there. And if I were to go ahead and show you how that happens, the software will calculate the safety zone around the load vector that's in there and will try to load the implant based on the position of the opposing cusp, the central groove, and the whole thing. So by double clicking on the implant here with the adjustment, notice again one more time the load vector will adjust and it will position the implant directly into the central pit of the lower tooth, which is the actual loading area that's going to be loaded by the lingual functional cusp of the opposing arch on the top. And then this will be a 5.0 by 13 millimeter implant in this case. The next implant that we're going to be placing on tooth number 30, again I'll double click on it, and this implant is going to be a 5.0 by 11.5 millimeters. Once again, notice the little bit of a wear on the buccal segment of the arch of this patient. Maybe the patient was wearing a partial denture and the buccal plate was destroyed a little bit. But we will angle the implant in such a way so we can maximize the position of the implant in the bone. More importantly, one of the dangers of freehanding implants in the maxillary zone is the lingual concavity. Notice this is the lingual concavity that we have in here, and most people would put their hands and palpate buccal lingually and think that they have a big wide ridge in there, but they seem to forget that there's a little concavity that goes down into the arch, and that's where most of the perforations that we see occur, on the lingual concavity when you freehand the implant. So it's always best to diagnose the cone beam CT and do a surgical guide to place these implants at the maximum position that will be allowed. Again, in this case, the implants are saved, And then once the implants are saved, one more time, again, the surgical guide will be generated. And in this view here, you could see the volume view. We could add the bone view to it. If we could add the bone in there, it'll give us bone tracing around the implant as well, where the nerve chamber is, away from the nerve chamber, where the lingual concavity is, the safety zone around the whole implant, and so on and so forth. We can also look at the tissue and the teeth that were reverse engineered. This is the surgical guide that was designed, and this is the tissue that is placed. The system will trace the tissue around as well to give us an idea if there's any enough attached gingiva to support the circulation around that area or not. And in this case, as you can see, this is fairly good. And if I remove the bone very quickly and double click on implant on tooth number 30, we will get the tracing, same thing on tooth number 30, put the bone back in. And if I were to zoom in on it, it'll give us a perfect tracing of the tissue, the bone, the implant, the teeth, the load vector, and the inferior alveolar nerve chamber that is in there. Now, if I were to remove all that completely and remove the volume view, remove the bone, and remove the tissue as well, and now put the surgical guide so we could see what the surgical guide looks like. This is the surgical guide that will be tooth-borne, and the surgical guide will determine the exact position of the angle where this implant is going to go. If I were to remove the teeth very quickly, these are the sleeves that will be inserted in the guide right here, and they are at different heights. Again, the two implants are slightly at different heights only because the area there of the bone has been resorbed by the partial denture that the patient's wearing, or due to the extraction that was done at the time. Notice that implant is going to be placed through the guide. Again, if I were to put the bone in there, this is the tracing of the bone. And if I were to put the tissue, one more time, the tracing of the tissue, the surgical guide is usually designed with 0.5 millimeter allowance for the tissue so that it can compress the tissue if you have to, but it will be tooth-borne, and it's usually designed with a 0.001 tolerance to sit on the actual teeth. So this technically should conclude the treatment plan for this case. A PDF report will be generated that will show you where the implants have been, which manufacturer you have chosen, which teeth number, what sizes, and that will come handy usually at the time of the surgery if you don't have the Google Glass and you're wearing the Google Glass to look at the treatment plan directly to you, or if you don't have a laptop or an iPad or something to play the video of the case while you're doing the implant procedure for the patient. And moving on from here, again, another part of the software that's very useful is the export module that we have. In the export module here, we will show you how you can select various models to print so you can actually practice the case before you actually get to do it on the patient. I'll show you that next. Here it is. This is the export module that will show you the surface scan of the patient. And this is the surface scan model, which is basically pouring the impression in plastic. We can print a model with the surface scan minus the implant. Notice this is the two implants that will go in here. We can print a model with the surface scan plus the implants. We can print a model with the articulator. We can print anything that you want. Also here, we could show the surgical guide as well for the patient. And this is the surgical guide that will be printed for this case, and so on and so forth. This is a very powerful portion of the software that we have that will allow us to provide you with anything that you would like to practice the case before you get to do it on the patient's mouth. One of the most powerful tools that InPronto will provide you as well is the automated generation of the animation of the implant process, so you can actually present the case to your patient. We call it animate to present. That's the trademark that we use. You animate the case and you show it to the patient to increase the patient acceptance of the case. In this case, I went ahead and animated all these areas that are shown in here. And I'm going to play the implant planning portion to show you a taste of the animation, and I will include that in there. The animation will be generated automatically. It shows how the implant's going to be placed. It'll show a slicer view that rotates 360 degrees around the implant, showing the safety of the implant relevant to the adjacent teeth, to the buccal lingual portion of the bone, to the mesial distal portion of the bone, and so on and so forth. So this is a very powerful tool because now you get to show this to the patient and you get to show that this is your mouth. It's not just some model that you're picking up off the shelf that's generic to show the patient. Patient usually, when they see that, this increases the patient acceptance. It's a very powerful marketing tool when you share this over the social media and send it to your patient, so they get to actually view this at home with their family and friends and so on. So this is a huge, powerful tool. Again, Animate and Present is the trademark for the InPronto software. So you get to actually present your case to the patient and show that this has been a calculated procedure. And now there's a whole marketing campaign that's going to go out there to try to educate the patients, to let the patient ask their doctors whether they do actually guided cases and they do it properly like this, and this way to avoid any kind of increased risk for these cases. This should conclude the treatment plan again, and I will include the animations as part of the video that I'll present to you.